Greetings and welcome Family Cafe attendees. This is the Florida KidCare Taking Confusion Out of Insurance Coverage for Kids presentation. We thank you for joining us virtually and are excited to share more information about this important program. My name is Amy Bogner and I'm the Public Affairs Advisor for the Florida Healthy Kids Corporation. I'd like to turn it over now to my co-presenter so she can introduce herself.
Hello, everybody, and thank you for joining. My name is Danielle Gutierrez, and I'm a Senior Product Operations Specialist for the Children's Medical Services Health Plan at WellCare. Back to you, Amy.
Thank you, Danielle. As we all know, health insurance coverage for children is very important, as it helps them to grow up healthy at each stage of their growth and development. Many people around the state may not know about Florida KidCare, and by the end of this presentation, Danielle and I hope to give everyone listening a better understanding of what it is, how it works, and a variety of ways you can help spread awareness about it to your friends and family and others. So let's start by answering the question, what is Florida KidCare? Florida KidCare is the state's high-quality, comprehensive health and dental insurance program for kids from birth through the end of age 18. There are 4 partners who provide programs under the Florida KidCare umbrella to offer this coverage. They include 3 state agencies: the Agency for Healthcare Administration, also known as AHCA, the Florida Department of Children and Families, known as DCF, and the Florida Department of Health, known as DOH. The Florida Healthy Kids Corporation rounds out the 4 partners. It is also tasked by statute with marketing the Florida KidCare program statewide. So before we jump into the details of how the program works, let's first talk about what children's health insurance looks like in Florida. So currently there are about 4 million children living in our state. 1.3 million of those children have private health insurance coverage through either a parent or guardian's employer. In addition, more than 2.3 million children are insured through Florida KidCare. This leaves about 339,000 children with no health insurance coverage at all. Now, of that number, approximately 174,000 may qualify for free or low-cost coverage through Florida KidCare. Now, personally, I like to put this into perspective using sports stadiums. As we all know, they're large venues seating thousands of people, and that typically helps to give most people a good visual representation of how many children we're talking about. So I live in Tallahassee and attend Florida State football games when I can. FSU's football stadium seats over 79,000 fans. So visualize this with me. You would have to fill this stadium with children 4 times over in order to show the number of uninsured children in Florida. And we're talking about that 339,000 number we just spoke about in this slide. It's a bit mind-boggling when you mentally try and picture it this way. So where do these uninsured children reside in our state? Well, there are 5 counties in Florida that have the highest number of uninsured children. They include Orange County, which is the Orlando or Central Florida area, Hillsborough County, which is Tampa on the West Coast, and 3 counties representing the Tri-County South Florida area of Broward, Miami-Dade, and Palm Beach. So diving into this slide just a bit further, it illustrates how many uninsured children there are in each of the top 5 counties, and that's by number. So as you can see, Miami-Dade County has the highest number of uninsured children at over 45,000. The other counties range anywhere from 17,000 to over 35,000 each in the number of uninsured children. So with many parents losing their jobs or seeing reduced work hours due to COVID-19, these numbers could be increasing. But Florida KidCare can be a solution for many of these families. And before we move on from this slide, if you look at the pink box on the right of the screen, you'll see that there's a website address at healthykids.org/data that shows you how you can access the number of uninsured children and other types of enrollment data to see what these numbers may look like in your county. And this information is updated on the website monthly. So this slide shows the breakdown of the 4 Florida KidCare programs. It identifies the age range covered for each. And as you can see, there's Florida KidCare at the top and the umbrella, Underneath, you have the 4 programs, and it starts with Medicaid for Children, which is birth through 18 years, MediKids, serving kids 1 to 4, Florida Healthy Kids, kids 5 to 18, and Children's Medical Services Health Plan, which is birth through 18 with special health care needs. And I can say here on this slide that when a child reaches their 19th birthday, just in case you're wondering, they would age out of the Florida KidCare program. So let's talk more about each of these programs individually. We'll start with Medicaid for Children. Many families we speak with at various community events and conferences do not realize that Medicaid for Children is a Florida KidCare program. It is. It covers children from birth through the end of age 18, and there is no cost to families for the coverage of all children in that family. For a child to qualify, a family must meet an eligibility requirement up to 133% of the federal poverty level. An important factor, especially for our non-English speaking families, is that a parent or caretaker's eligibility is not considered in this process and would not impact a child's ability to obtain coverage. This program is administered by ACA, and eligibility is determined by DCF, which is who would most likely be communicating with a family regarding acceptance into this program. And with the largest enrollment of any program, there are over 2 million children enrolled in Medicaid. So as we move into MediKids, that's the next program, it covers children between the ages of 1 through 4 who are not eligible for Medicaid. For this program, there are 2 options available for coverage based on a family's total annual income. So there's subsidized coverage with parents whose income falls between 133 and 200% of the federal poverty level, and they would pay either $15 or $20 a month for all children in the family. And then there's parents who have incomes above the 200% of the federal poverty level threshold. There's a competitively priced full pay option that is $157 a month, which includes health and dental insurance, but it is a per child cost, and that is an important distinction to remember. Children in this program receive Medicaid benefits and use Medicaid's providers for doctor visits and other medical services. And there are over 42,000 children enrolled in this program. The next Florida KidCare program is Florida Healthy Kids. It covers children ages 5 through the end of age 18. And for those in the MediKids program, many will transition into the Florida Healthy Kids program when they turn 5, which gives families seamless coverage. As with MediKids, this program offers 2 options based on a family's total annual income: the subsidized coverage at $15 or $20 a month for all children in the family, and full pay coverage at either $230 a month per child for health and dental insurance, or parents actually have a choice of a health-only plan at $215 a month per child. The Florida Healthy Kids Corporation administers and determines eligibility for this program, and there are more than 218,000 children currently enrolled. So as a fun way to test your knowledge and help you to remember this information, we're going to stop on occasion for a review checkpoint. So here's our first one. True or false? Florida KidCare will cover children from birth through age 19. This answer is false, because Florida KidCare only covers children from birth through the end of age 18. Again, when a child turns 19, they're no longer eligible for Florida KidCare coverage, and they would need to seek either private insurance coverage through an employer, or they may qualify for a parent's private insurance as a dependent if they meet other criteria. For those where this may not be an option, they can look to the federal marketplace for coverage. Is Medicaid for Children one of Florida KidCare's programs? As we discussed earlier, it absolutely is. So at this time, I'm going to turn over the presentation to Danielle.
Thanks, Amy. Children's Medical Services Health Plan is the state of Florida's affordable, high-quality, comprehensive health insurance program for children with special health care needs. So let's talk about eligibility. The CMS Health Plan is a specialty plan for children from birth through the end of age 18 with special medical conditions. Clinical eligibility is determined by the Department of Health. There are 2 ways to determine clinical eligibility. One is through a brief verbal parent survey, and the other is by a physician attested. In the family. The CMS health plan is comprised of a special network of physicians and providers that provide a full range of care through prevention, early intervention, primary, and specialty care. Now let's do a little review checkpoint. True or false? There is only one method for CMS health plan clinical eligibility determination. If you guessed false, you were right. There isn't one way, it's two ways, through the parent-based survey or by a physician attestation. On the right is the clinical eligibility helpline. You can call that number toll-free for more information. Next slide. So it's important to note that the Florida Department of Health administers the Children's Medical Services Health Plan, and WellCare of Florida is the sole vendor operating the plan on behalf of the Department of Health. The Florida Department of Health partners with WellCare to provide extensive support for all CMS health plan members, including but not limited to comprehensive benefits and provider network, including dental, vision, hearing, and specialists, high-touch, community-based, and pediatric-focused care management. We have a unique care management model where every single Children's Medical Services Health Plan member is assigned a primary care manager who will work with them and their family to navigate through the health system and create a specialized care plan that is centered around the member's conditions and needs. We also have 16 welcome rooms throughout the state where KidCare applications can be submitted. Members and their family can utilize resources such as computers, telephones, and TV, as well as getting any questions answered that they may have in person. We also have a community assistance line that is open to the public and links members and their families to hundreds of community resources, such as getting utilities paid, medication assistance, affordable childcare, and more. The flyer on the right goes a little bit into more detail about the community assistance line and will be available for you to get after this presentation. So let's talk about extra benefits and programs. The CMS Health Plan is proud to provide extra benefits and special programs to children who are enrolled to help them achieve their health goals. A few of the benefits include carpet cleaning for children who may have asthma, housing assistance, transportation, over-the-counter items, pest control, swimming lessons, and tutoring services. Our most popular benefit is the over-the-counter benefit. This is where each household gets $25 a month in order to order over-the-counter items and are sent to them free of charge. Next slide. As I mentioned earlier, we have a unique care management model where each child has their own care manager that works with them and their family to find benefits and services that will benefit their health. For example, a CMS health plan member who has asthma may benefit from the following services, such as a quarterly check-in by phone from their care manager, carpet cleaning at their home assessment for trigger reduction, getting hypoallergenic bedding for the child, as well as a HEPA filter vacuum cleaner. Let's do another review checkpoint. Which Florida KidCare program is specifically for children with special health care needs? The right answer is the Children's Medical Services Health Plan. This plan is for children from birth through the end of age 18 who have special medical conditions. Let's do another one. True or false? The Florida Healthy Kids program covers kids aged 5 through the end of age 18. The answer is true. The Florida Healthy Kids program is for children ages 5 through the end of age 18 who are not eligible for Medicaid. Let's talk about our Behavioral Health Network program, also known as BNet. BNet is for children with serious mental health or substance use needs who are insured by the Florida KidCare and enrolled in either the Florida Healthy Kids Subsidized Plan or CMS Health Plan. Children receive behavioral services for the treatment of their behavioral conditions, as well as the medical services of the CMS Health Plan. Services might include treatment planning and review, case management, counseling, therapy, residential and daycare treatment services, family support, and many other services that not only benefit the member, but their family as well. Families pay their $15 to $20 monthly fee for the CMS Health Plan coverage, and there is no additional charge for children being enrolled into the BNet program. Eligibility is based on the severity of the child's mental health or substance use condition, and BNet is available in most areas of the state. If you think that your child may qualify for BNet or have questions about the program, you should talk with your child's primary care physician or CMS Health Plan care manager about a possible referral to BNet. Back to you, Amy.
Thank you, Danielle. So now let's move into talking about eligibility. Oh, I'm sorry, let's talk about benefits first. So we've discussed the 4 different programs under Florida KidCare. The benefits that are provided through all of these programs include such things as doctor visits, dental cleanings, prescriptions, mental health services, well checkups, shots, and emergency room visits, just to name a few. Depending on the program a child is enrolled in, the copay cost for these services will typically either be free, $5, or $10 per visit. Now, as an example, a 31-day supply for a prescription would typically cost $5 each. For a well child visit with the child's doctor, it would be free. An emergency trip to the hospital by ambulance services, now that's going to cost $10. So these are very affordable costs for families. We've hit another review checkpoint. So true or false? Florida KidCare doesn't cover any dental benefits. Well, this is false because all Florida KidCare programs either include dental benefits in the premium cost if there is one per month, or it's offered as an option for a parent to purchase. A parent can opt out of dental coverage in only the Florida Healthy Kids full pay plan. They would only have a plan with health insurance coverage and no dental. So true or false? The BNet program is offered to enrollees of the Florida Healthy Kids full pay plan. This is also false. The BNet program is offered only to enrollees in the Florida Healthy Kids subsidized plan, which is again for children from age 5 through the end of age 18. And these families would only be paying $15 or $20 a month for all children in the family. So now let's talk about who is eligible for Florida KidCare and the requirements to apply. Eligibility is based on household size, a family's total annual income, and the age of the child. Some of the criteria include the child must be under age 19, they must be a Florida resident, they must be a U.S. citizen or lawfully residing immigrant. So let's talk about that real quick. The Florida legislature passed a law in 2016 that's helping many immigrant children who lawfully reside in Florida obtain health insurance coverage. So prior to this change, some non-citizen children living in Florida had to be lawfully in the United States at least 5 years before they qualified for health insurance coverage through Florida KidCare. Since the law went into effect on July 1, 2016, there was no longer a waiting period for these children. So continuing down this list, to qualify for Florida KidCare coverage, a child must not reside in a public institution, and they must also meet income eligibility requirements. So let's talk about that more. This slide is the 2020 Federal Income Guidelines chart and provides families with an easy way to help determine which Florida KidCare program they might qualify for and what they may have to pay for a monthly premium. So for example, let's look at a family size of 6. So on the far left column under family size, scroll down to the number 6, which would include a mom and dad and 4 children. Let's estimate that their family income is $48,000. So you would move to the second column, which shows at the top in pink that this family would qualify for either the Florida Healthy Kids or Medikids programs. They would qualify for either the Florida Healthy Kids, Medikids, or CMS plan. And this would depend on various factors such as their age, special health care needs, etc. And it would be a $15 a month premium for all children in the family. So likewise, if you have a family of 3, so let's find that under the family size in the chart. Again, a mom, a dad, and maybe 1 child. We have a total annual income of $50,000. So we are going to move all the way across to the very last column. And as you can tell in teal, that is our full pay plan column. So they would be over that 200% of the federal poverty level, which means they would qualify for either Florida Healthy Kids or Medikids program's full pay plan option. And it's going to depend on the age of the child as to what the cost is per month. So in this next slide, this is actually the back side of that federal income guidelines chart. And it is a kind of a program eligibility overview. So what it shows is, it shows the qualifications by program at the federal poverty level. So when you look at this, you see that up to 133% of the federal poverty level qualifies a child for Medicaid for children. If you look at the 133 to 200%, that qualifies for subsidized coverage through either Medikids, Florida Healthy Kids, or the CMS plan. And I know it's not listed on here, but it's at the very bottom, but it does qualify for that. Anything over 200% of the federal poverty level, which is in the pink and teal at the top, would qualify for a full pay plan with either Florida Healthy Kids or Medikids. So just trying to help you read through how this chart is. And a PDF of this document is actually going to be provided in the handouts with this presentation. So we've reached another review checkpoint. Does the parent or guardian of the child need to be a U.S. citizen for the child to be eligible for Florida KidCare? No. The parent or guardian status is not relevant in this decision. Only the child needs to be a U.S. citizen or lawfully residing immigrant to be eligible for Florida KidCare. So when adding up the family size, who does that include? It includes anyone living in the household. The guardians, the parents, the children, other siblings, and anyone else, such as aunts, uncles, grandparents, you name it. So this slide shows another tool for helping families determine their monthly premium payment, and it's called our Eligibility Calculator tool. It was launched 2 years ago and is one of the most popular web pages on the Florida KidCare website. It's also extremely easy to use. A parent needs to answer only 2 questions to submit for determining their premium payment. And those 2 questions are, what are the number of people in the family, or how many? And then what is their annual household income? And that would be the combined annual household income. Now, before we show you the next steps on the eligibility calculator, I wanted to quickly mention that both the Florida Healthy Kids and Florida KidCare websites have tabs at the top right-hand corner of each of their home pages that allows families to access this information in both Spanish and Haitian Creole. This means non-English speaking families can use the eligibility calculator in their own language, as seen in this slide. So getting back to how this works. So the 2 previous questions, as an example, I entered 4 people as the number of people in the family. I entered an annual income of $45,000. So what that does, as you can see, it estimated that this family would pay a $20 premium for all children in the family. And then a parent, as you can see at the results, can move ahead and apply for Florida KidCare. They can get additional help, They can email these results to themselves for later reference, or take a closer look at the 2020 Income Guidelines document as a link, which is what you saw earlier in this presentation. So this slide shows it's a recap of the full pay options that we touched on earlier. Again, that's non-subsidized coverage. It's at that 200% or higher of the federal poverty level. Only 2 programs under Florida KidCare offer these full pay options. First is Medikids for children aged 1 through 4 at $157 per month per child with dental. It's health and dental. And then Florida Healthy Kids, which offers for kids age 5 through the end of age 18, 2 options. The $230 per month per child is health and dental, and the $215 per month per child is excluding dental, so it's health only. So in this part of the presentation, we wanted to provide an update on some changes applying only to the Florida Healthy Kids full pay plan that occurred as a result of legislative efforts last year. The Florida Healthy Kids Corporation, along with legislators, community partner organizations, and many others, championed a legislative funding initiative to combine enrollees of the full pay plan with the subsidized plan. And this would lead to lower costs and benefits for these enrollees. It was passed by the legislature and signed by the governor last June and became effective on January 1st of this year. So a couple of things to note about participation in the Florida Healthy Kids full pay plan. There is no threshold for families who earn over 200% or more of the federal poverty level to participate in this program, even if they work. And as you can see, we show an example at $52,404 for a family of 4. So if you had a family of 4 and you earned $75,000, you earned $85,000 total annual income, you would still be able to qualify for the full pay plan. It can be a less expensive option for children who are currently covered with private insurance through their parent's employer. So a parent may be able to receive private insurance through their work for free or at a low cost, and this is what we've heard. But when they start to include their spouse and dependents, it then becomes cost prohibitive, very expensive. So the Florida Healthy Kids full pay plan could be a more affordable option for these families, and we recommend that they look into it. So what are the key changes in the Florida Healthy Kids full pay plan that will benefit parents the most? So previously, the full pay plan required parents to meet a $3,000 medical deductible, a $1,500 pharmacy deductible, and pay a 25% coinsurance fee for coverage each year. So with the new changes effective January 1st, all deductibles and the coinsurance fee, they're completely eliminated. Charged no more. In addition, co-pays that used to cost $25 or $40 a visit now only cost $5 or $10 a visit for certain services, and some of them are free. Parents will still pay either the $215 a month per child premium cost, again for health only, or the $230 a month per child premium cost for both health and dental insurance coverage. And then again, the only other thing they're paying for are these copay costs. So on this next slide, you'll see a map of Florida, and what it shows is the 3 health plans and 3 dental plans offering coverage as of January 1 of this year for both the subsidized and full pay Florida Healthy Kids plans. United Healthcare, Stay Well Kids, and Sunshine Health are no longer offering coverage through the Florida Healthy Kids program in 2020. They had been in 2019, but they are no longer, and that is a change. Aetna, Better Health of Florida, and Simply Healthcare plans offered regional coverage in 2019, which means they only offered for certain counties, but both are now offering coverage statewide this year. Community Care Plan is a new health plan offering, but it's available to members who reside in only 8 Southeast Florida counties, and you can see that in the dark blue part of the map. These include Indian River, Okeechobee, St. Lucie, Martin, Palm Beach, Broward, and Miami-Dade. The 3 dental plans have not changed for 2020, and these include Argus Dental Plan, DentaQuest, and MCNA Dental Plans. So same ones that offered coverage in 2019, still offering coverage in 2020, excuse me. So let's stop for another quick review checkpoint. Does the Florida Healthy Kids Program full pay plan have 0 deductibles and a 10% coinsurance fee? No, there are no deductibles or coinsurance fees for the Florida Healthy Kids full pay plan. When did the Florida Healthy Kids full pay plan changes take effect? Again, January 1, 2020, or January 1 of this year. So for a change in pace, we'll now be doing a couple of quick activity scenarios to put into use what you have learned so far. The goal is to help you better understand how the program works and how eligibility is determined using the federal income guidelines document you saw earlier. So usually in the conference breakout sessions done in person, you would receive a copy of the income guidelines in a few minutes to do this activity on your own. But as a virtual exercise, we'll walk you through it as we go. I'll now turn it over to Danielle for our first activity.
Thanks, Amy. So Bianca is a single mother with 2 children, Gary, who is 5 years old with special medical needs, and Daisy, who is 3 years old. Bianca makes a total of $35,000 a year. With this information, which Florida KidCare program are Bianca's children eligible for? Due to Bianca's income, both children will be covered under a subsidized Florida KidCare program. Gary would be eligible for either the Florida Healthy Kids program or the CMS Health Plan. Daisy would be eligible for MediKids, and Bianca will pay $20 a month for both children.
Thank you, Danielle. Let's try one more. So in this particular activity, you have Brody and Ashley with 3 children. Gina's age 8, Anna's age 10, and Emma is 13. The couple together make $70,000 a year. So using this information only, which Florida KidCare program are Ashley and Brody's children eligible for? All 3 children are eligible for the Florida Healthy Kids full pay plan due to the family's combined income at $70,000 a year. Ashley and Brody will pay $690 a month for all children. And you can see on the income eligibility guidelines portion on the screen that we've circled the income. As you can see, they're at $70,000, so they're over that $61,368, and so they would qualify for the full pay plan. So they pay $690 a month for all 3 children, and that number comes about because you're doing $230 a month times 3. If they were to choose the option without dental insurance, which is $215 a month, times 3, that would be $645 for all children in the family every month. And you can see how this is found using that federal income guidelines document. So we hope you'll be able to use that in reference when you are looking at it. So the next slide is extremely important. It shows how families can apply and when. Florida KidCare enrollment is open year-round, meaning there are no special enrollment periods during the year like you may see with private insurance. You can go online, you can download and print it, you can apply by fax, and you can request a mailed application 24/7, 365 days a year. So with these 4 options, we do want to make sure that you know that if you do request a mailed application, it is available in English, Spanish, or Creole. When you download and print an application, you have the ability to get it in English, but you can request by phone to receive it in the Spanish or Creole. It takes approximately 4 to 6 weeks to process an application, and coverage begins only on the 1st of the month after a child's eligibility has been determined and the first month's premium has been paid, if a premium is needed. Parents will need to renew their child's coverage every year, but are notified of this electronically and able to update the same way for a smoother process. So our last several slides are going to provide a variety of resources that are available to families and those who would like to help promote Florida KidCare in their communities. In this slide, you can see examples of the Florida KidCare brochures and postcards, that are available to request free of charge from the healthykids.org website, and it's under our resources tab. This includes brochures in English, Spanish, and Creole, and postcards in English and Spanish. These will be shipped free of charge with the minimum allowable order of each item at 200. We also have some promotional items to help organizations spread the message in their local communities at events and meetings. These are free as well, but you will be charged for shipping. And they include such items as pens, pencils, hand sanitizers, which are definitely applicable in the COVID-19 age, and bandage dispensers, which we find help a lot of our schools and nurses. We've provided a copy of our marketing materials order form as a handout with this presentation, or you can visit the website listed on the slide and complete one at your leisure. Also, please know that due to the current situation with COVID-19, we are not shipping orders at the moment, but we also will resume doing that again as soon as we possibly can. But in the meantime, you can submit a completed order form, and we're just going to hold on to it until we're ready to start that shipping process again. So this slide shows our KidCare Connector newsletter. It's sent to families on a quarterly basis and provides updates on Florida KidCare and a variety of issues pertaining to health and safety awareness messaging relative to that quarter. Content is provided to us by our funded community partners, health and dental insurance plans, and state agency partners. And it's not only for members. It is available to anyone who would like to receive a copy and can be found on the healthykids.org website, again, under the Resources tab, where you would select KidCare Connector Newsletter inside the right-hand More Information box. But if you want to join the email list, it's easy. There's two ways to do that. You can send me an email with that request, and my contact information will be at the very end of this presentation. Or you can open an archived edition of the newsletter. And as you can see from the graphic on the screen, there's a red circle, and that shows where the join email list option is. So you would just click on that, and it would allow you to register to receive future editions. Our next one will be released in mid-July. So another great resource for families across the state is the Outreach Calendar. This calendar is updated frequently and lists various events and meetings being hosted by our school and community outreach partners. It's an easy way to find an event that may be available to provide application assistance for families and/or materials and promotional items, and to get any questions you might have answered about Florida KidCare. So we've reached our last review checkpoint. When is the enrollment period for Florida KidCare? If you said anytime all year long, you're right. So the best time to apply would be now. Are there different applications for every Florida KidCare program? No. There is only one application for a parent to complete. The child is then placed into the appropriate Florida KidCare program after a review of that application, and depending on the child's age and other criteria. So our goal today was to give you more information about how the program works, what the criteria was for eligibility, and the various ways a family can apply for that coverage. We hope you will consider being a Florida KidCare champion in your community and help us to spread the word so that more children can receive health and dental insurance coverage in our state. As a reminder, there are several handouts that have been provided along with this presentation, and we definitely encourage you to take a look at them. If you have any questions or comments, feedback, anything that you would like to ask us, my contact information is on the slide, and if you have any questions about the CMS health plan, the Ombudsman website address and phone number is also listed. On behalf of Danielle and myself, we thank you for listening to this presentation and look forward to hearing from you. Thank you.